Hi, this is Dr. Jared Garris. I'm the Glenn County Health Officer, and I'd like to go over the church employee and volunteer training. There's been kind of some updates and changes, and I wanted to kind of review those and get things updated just a little bit. Unfortunately, as we're going with COVID-19, we're learning as we go, and there's just some information that should be updated. So first off with COVID-19 and churches. So it's very clear that churches and COVID-19 have not mixed well. Many of the larger outbreaks in many of the communities in the United States as well as the world have been related to churches. And so kind of a famous one is up in Washington. They had a 60-person choir, and they ended up, after choir practice, they ended up spreading it to 45 of the different people from the choir. There was multiple hospitalizations, and there was 2 deaths that was associated with that. More locally, we had in Sacramento, we had one church that had 71 people who contracted COVID-19. There was multiple deaths associated with that. And then early on in Redding, they had one church that had 6 people who contracted COVID-19. At the time, they only had 23 cases, and one of the ministers there actually ended up dying from that. In Glenn County, we've had 4 outbreaks that have been associated with the churches, and those have been relatively small, and that's because we've done a pretty good job of complying with the guidelines. So what we do really makes a significant difference. So the primary mode of transmission for COVID-19 is respiratory droplets. And respiratory droplets are those little droplets that leave our lungs as we're breathing or speaking or coughing or sneezing or singing. And singing really sends out a lot of them. And the louder you sing, the more that they fly out there. And so, but there's some things that we can do to try and decrease the amount that actually makes it to everybody around them. And one of those is distance. Just taking a few steps back allows that to be able to dissipate. Time. So the more time that people are in close proximity, the more likely it is for them to end up getting enough of the virus that it actually makes them sick. And then infectivity. So depending on how infectious somebody ends up being, that makes a significant difference as well. And then there's kind of a concept of that we talk about a lot in medicine called CFU, or colony forming units. And so for virus or bacteria, if you get just one, usually our body's immune system takes care of it and there's no issues. It's you have to get enough of a dose that it actually overwhelms your immune system before it actually causes you to get sick. One of the things that's a little bit unique about COVID-19 is the larger exposure you get, the more of the virus that you end up getting, chances are the more likely you are to end up getting, the more severe of disease you'll get. So kind of a little bit unusual with COVID-19. I love this picture. This is from the CDC. You can see this man coughing, and you can see all of these respiratory droplets just flying towards me. So we talk about that 15 minutes, but obviously, one good douse from a cough or a sneeze, and you could see how that could end up leading me to get sick. I like this also because you can clearly see how if I take a few steps back, this starts to dissipate more and it becomes less likely. A good cough or sneeze usually goes 8 to 10 feet. So being back just a little ways is going to help dissipate with that as well. You can also picture that if he was to cough into his elbow, how that would really decrease the amount of respiratory droplets that were shed. The other thing is you can picture how if he was to have a mask, most of those respiratory droplets would be contained in that mask, or they would only go a couple of feet instead of flying out that 6 to 8 feet. So I like that picture. So who's at the greatest risk? So those that are 80 have a 13% chance of dying. So somebody who's over 80 years old, there's a 13% chance that they will die. The more medical problems you have, the more likely you are to die from COVID-19. And nursing homes, where people tend to be the most frail, there's a 25 to 30% chance that if one of them develops COVID-19 that they will die. So pretty significant. Of the medical problems that seems to be associated with death, diabetes seems to be the most common. High blood pressure, interestingly, something I don't usually think of as having a lot of significance, but with COVID-19, that seems to have a lot of significance. Obesity does, heart disease does, COPD or emphysema does, but less than the other ones. Kind of a little bit interesting. I also want to just mention that that tends to be who ends up dying, and it also, to a lesser extent, ends to predict who ends up needing to go into the hospital. But in Glenn County, we've had 4 people who were in their 20s who ended up needing to be hospitalized, and 3 of them ended up in the intensive care unit. So it's very uneven, and sometimes it's a little bit unpredictable as to who's going to get really sick and who's not. And maybe that has something to do with the amount of virus that they end up being exposed to. With COVID-19, talking about the bad on the last slide, interestingly, about 80% of people who develop COVID-19 will have mild or no symptoms. Matter of fact, we say that 25% of people will have absolutely no symptoms at all. I'm a big fan of the 80-20 rule, and that kind of just means that if we focus on a few key things, that most of the things take care of themselves. And focusing on those respiratory droplets is going to be the main thing that we can do to help protect our congregation. Key things: staying 6 feet apart, keeping our interactions brief, just kind of like what we were talking about. No singing. Singing really sends out those respiratory droplets, and that's why there's been so much with the churches with COVID-19. This is these singing and those respiratory droplets. Wearing a mask makes a significant difference, and so that's really important that everybody wear a mask. And keeping sick people from coming, and we'll talk a little bit about that more later. And then we also need to have a plan as to how we're going to handle it when somebody comes and they're not wearing a mask or they're not willing to do that social distancing. Because the best plan written, if it's not actually done, really didn't help anything. So it's important to have some plans as to how to handle those situations. I like this. This is an informatics that was taken from a study from Lancet. It was released about 6 weeks ago. They scoured the world for all of the data regarding personal protective equipment and COVID-19, and tried to get some ideas as to how much protection each thing gives. So with physical distancing, they found that that being a meter apart, because the rest of the world does things by meters, so about 4 feet apart, you're 5 times less likely to contract COVID-19. When you extend that to 6 feet, you're about 8 times less likely to contract COVID-19. So distancing makes a difference. Wearing a mask. So we talked about how when we wear a mask, it protects everybody around, right? It keeps those respiratory droplets in. But when the person who's wearing the mask also receives protection, and there's a lot of things that go into this type of mask, but in general we say that people are about 5 times less likely to contract COVID-19 if they're wearing a mask. So that's significant. The other thing is that when we have some kind of eye protection, we say that people are about 3 times less likely to contract COVID-19. The cells that have the receptor for the SARS-CoV-2 include the eyes. So for the most part, it's in the deep nasal passages and in the lungs, and to a less extent in the eyes. And so when we have something that covers our eyes, that decreases our chances of developing COVID-19 by about 3 times less likely. I do want to make mention about an interesting study that was released in JAMA just a couple of weeks ago, where it was home health agencies, and what they did was they had the home health agencies going out and taking care of people who had COVID in their homes. And after a certain period of time, there was 19% of the nurses and the staff ended up contracting COVID-19. They went ahead and they instituted using face shields in addition to their mask, and that dropped to 0. Same amount of time, same number of employees, but it went from 19 to 0. So there does seem to be a fair amount of protection that's given by wearing those face shields, and it kind of makes sense. It protects your eyes, and then it's an extra layer to help protect your respiratory system. So Mention that for anybody who's you know, a little bit more fearful about coming to the congregation. Maybe adding a face mask or a face shield might be something that would be helpful. So symptoms of COVID-19, there's a bunch of them. So we've got fevers, cough, shortness of breath, chills, repeated shaking and chills, fatigue, muscle pain, headache, sore throat, new loss of taste and smell, nausea, vomiting, diarrhea, nasal congestion, runny nose. So really you could almost say if you're having any sickness at all, stay home, right? That's in my mind, that's really kind of the take home from that. Want to talk for just a second is a new loss of taste and smell, okay? This tends to be the most common symptom that's associated with COVID-19. Happens about 70% of the time, and it tends to be one of the first symptoms of COVID-19. So that becomes very important, and I'll share why in just a second. And then the other thing is this tends to separate COVID-19 from other things. So usually when we get a cold, maybe we don't smell and taste as much. With COVID-19, oftentimes it's very profound. People get up, they go to eat breakfast, and it's like all of a sudden they can't taste anything, just absolutely no sense of taste or smell. And so if we can pick up on this symptom early on and stay home, then it really decreases the chances of spread. When are people most infectious? 2 days before the onset of symptoms and 3 days after symptoms start. So kind of the frustrating thing with this is that usually people don't really start getting sick from COVID-19 until after about day 5. And so people are most contagious when they have absolutely no symptoms or when their symptoms are mild. And that's one of the things that we really have been battling with this is that if everybody got sick and it was early on, it would be much easier to try and fight this. So the take home to me is we need to treat everybody around us like they have COVID-19, whether they feel good or not. And we need to treat ourselves like we have COVID-19, whether we feel good or not. Need to self-monitor. If you have any of the symptoms that we talked about, you need to stay home. And this is going to be true for everybody, not just the workers that help out with, with church. Volunteers are paid, but any of the members from the congregation. If they have any of the symptoms mentioned before, so pretty much if they have any symptoms of being sick, they need to stay home. And if you've been around anybody who's sick, I'd encourage you to stay home. Think about the little old lady who's in your congregation and stay home for that week to help protect her. What do I do if I develop these symptoms? First thing is to stay home. The other thing is to get tested. We say that, and you need to, while you're waiting for those results, you need to stay home. We need to, when people contract COVID-19, they have to isolate or stay home and away from other people for 10 days. And they have to be without fever for at least 24 hours. So that's an and. So it's a minimum of 10 days, but it can be longer if people are continuing to have fevers. And you can get tested by either contacting your local primary care provider. Make sure you let them know that you're wanting to get tested for COVID. They'll probably have you do it outside. And the other option is the OptumServe, which has been really a nice thing that is absolutely free. If you have a known exposure to COVID-19, and a high-risk exposure is more than 15 minutes at less than 6 feet. And in Glenn County, we've been able to identify where 85 to 90% of people contract COVID-19. And it falls into these categories. All of them where we know exactly where they contracted it fall into that category. That accounts for the vast majority of spread of COVID-19. If you have a high risk exposure, you got to isolate or you have to quarantine for 14 days. That means staying home, staying away from other people. The reason for the 14 days, so if you get sick, it's 10 days. It's 14 days if you get exposed, because it takes about 5 days for people actually to start having symptoms. 5 to 6 days on average for people to start having symptoms. But sometimes people can go even 2 weeks, the full 14 days before they start having symptoms of COVID. If you should develop severe symptoms, persistent pain or pressure in the chest, confusion, blue lips or face, or unable to catch your breath, you need to go to the emergency room. Cloth masks and face coverings. They do not protect the wearer as much as they protect everybody around them. And you think about that person with the sneeze and about a covering and how those respiratory droplets just don't go out. It makes a big difference for protecting everybody around them. Now, the person wearing them also probably gets 5 times less likely to contract COVID, but it protects everybody around them. So this is one of those things that we can do that's Christ-like, that helps to protect the members of our congregation. Something that we can do, the uncomfort of wearing a mask to protect those around us. It does not replace physical distancing. This is something that we want to do in addition to that 6 feet. It needs to cover the nose and the mouth. So there's a bunch of videos out there that demonstrate this very clearly with the respiratory droplets, that when it's just covering the mouth, that there's just no protection given to the person wearing it or to those around them because we just breathe through our nose. We need to clean our hands after touching the outside of the mask. So if we've got those respiratory droplets, they go ahead and they touch the outside of the mask, and then we touch our hands, well, then that's potentially contaminated. And so we need to wash our hands or use a little bit of hand sanitizer. We need to avoid touching our eyes, nose, and mouth. We need to wash our mask periodically, at least every shift. If we have somebody in the congregation who's unable to wear a mask, a face shield with a drape, and they have those on Amazon. They look a little bit like a spacesuit helmet, but that is an option for those that have anxiety or are having difficulties time breathing through a mask. Hand washing. Hand washing should be for 20 seconds. Hand sanitizer is highly effective at neutralizing the SARS-CoV-2 virus. Should be either a 60% ethanol or higher, or 70% isopropyl or higher. In summary, COVID-19 symptoms can vary from none to life-threatening. Older individuals and those with more health risks are absolutely at more risk. It's important to recognize symptoms, to stay home, and to get tested. Respiratory droplets is the primary mode of transmission, and the things that we really can do to decrease the spread is going to involve providing more distance between people, wearing a mask, and avoiding seeing. Thank you very much.